Hello everyone, welcome back to my channel. Today I will be talking about depression, the pharmacological aspects of depression. Let's see what is depression. Of course, depression is a common psychiatric illness nowadays. It's also a highly prevalent condition that cause recurrent health issues. Some of the main features of depressions are depressed mood, markedly diminished pleasure or interest in activities, weight loss or weight gain, loss of energy and motivation, and also it can alter your sleep wake cycle that can cause you feel sad, worthless, or hopeless. Those are the main features of depression. Prevalence of depression ranges from 20% to 25% in women and 7 to 12% men at a lifetime. As you can see, women are more prominent to get depression than men. WHO has forecasted depression to be third leading cause of disability worldwide by 2020, and it will become a greatest global burden by 2030. As you can see, as the situation of nowadays, we can see people are more prone to get depression due to so much of stress going around there. Depression scale. What is the depression scale? Actually, a depression scale is used to detect whether whether a person can diagnosed by a depression. What is the marking point? What is the actual point that we can diagnose a patient that him or her have depression? Depression scales are used for that. They were developed more than 40 years ago. Some of the depression scales are Hamilton Depression Scale, PHQ 9, Patient Health Questionnaire 9, Beck Depression Inventory, and Hospital Anxiety Depression Scale, Symptoms Checklist, and ICD 10 are some of the depression scales that we can use clinically as well as in research purposes to diagnose whether a person have actual depression or not. What are the treatments for depression? Psychotherapy as well as pharmacotherapy can be used as treatment for depression. I have not mentioned here, but nowadays people are using traditional medicines and traditional aspects for depression as well. What are the psychotherapy? CBT. CBT, cognitive behavioral therapy, can be used as a psychotherapy for depression. As we simply say, you can use a counselor, a professional counselor to treat your depression. There are many other behavioral therapies that a psychotherapist can use to treat a depression patient. What are the pharmacotherapies? Pharmacotherapies means drugs. If we can't control depression along with psychotherapy, we have to move on to pharmacotherapy. That means to drugs. In 1950s, as I remember, depression drugs are discovered. TCS and MOIs, tricyclic antidepressants, and monoamine oxidate inhibitors are firstly introduced depression drugs for treat depression. But due to high side effects and other adverse events, people needed a more efficient one like SSRI and SNRIs are then introduced. Nowadays, most of the time SSRIs are used as first line therapy for depression. SSRIs, selective serotonin reuptake inhibitors, are used. Most of the examples are fluoxetine, paroxetine, sertraline, and escitalopram. SNRIs, selective norepinephrine reuptake inhibitors, like venlafaxines, are mainly used nowadays. Okay, that's it about the pharmacological aspects. Always be free from your stress and be happy. Thank you.